And then Mumukopani, how do you arrive here? Ambulance here go FH. Hey, Mara, for you, I must bill Mnangagwa. Because really, I'm transporting you every time you come here. What is Mnangagwa doing? He's doing nothing, and Phophi Ramathuba is doing his job. We are going to Mnangagwa is out of order. He must do his work. I'm going to bill him. No, Mara, maybe Jan, let's really be serious. Let's cost all the foreign. Those that, especially even with our rural health matters, we send the bill. And all the deliveries in our hospitals, those that have left, we must send it to their government. And I will even issue a press statement. The Limpopo government has sent a bill of so many millions for this month for Zimbabwean nationals who cross the bridge to come and deliver. And even now you are even attending antenatal. you know them killing Kombusina. Somebody had when you don't have the card from Zimbabwe, you are only having the South African. Yeah. You know there are cards in the Zimbabwe where they write, I'm sure they will write a place of delivery. I think you must book to where you booked. Are South Africa. That's what their nurses are writing. Yes, that's what they are writing now. But they are going to give birth for South Africa. That's I know because there's nothing there. And they not really midwife. I'm sympathetic to them. I want to be driving this on because it didn't play so Marabab, it's a baby and a mother. I suppose never Mnangagwa president. Marakobuba baby of yours. He must pay me.
So let me see. Here we have Dr. Joyce Amatinata.
Oh, how are you? Yes, from the...
Yes, the team is here training and...
Today news on Prince Miller Entertainment TV. Remember guys to like, share, comment and follow. Today is the 1st of September at 2022. Happy new month. And so guys, South African Limpopo MEC for Health Dr. Phophi Ramathuba. Yes, she's not backing down. Healthcare for Zimbabweans, for foreigners in South Africa. That's the latest video which is making rounds on social media. Everybody is talking about that video again. And yes, the other one negative viral. This one she's also saying the same sentiments, which you know what, you guys are gonna treat you, but your government is gonna pay. That's it. And it seems like she's now getting more momentum from politicians who support her sentiments, including the president of South Africa, is Phophi Ramaphosa. The man said apana chakayapa chakambotora na MEC vakatara zvakanaka, but vakataura at the wrong place at the wrong time and with the wrong person, because we need to discuss this kind of issues at a national level, which means that you will have to speak to President Mnangagwa regarding to health care of foreigners, especially Zimbabweans who are in South Africa, who are based and living in South Africa. And so I went on social media, of course, regarding to this, including our favorite journalist Phophi, who will be hosting MEC today on Twitter at 7 o'clock. It should be with Phophi by Twitter, doing Twitter spaces. Foreigners, especially Zimbabweans who are seeking help, medical care in South Africa. Phophi said that what is Mnangagwa doing? Is he doing nothing? And Phophi Ramathuba is doing his job. He says the Limpopo MEC for Health, Dr. Phophi Ramathuba, speaking to a Zimbabwean who was in South Africa to give birth. Mnangagwa is out of order. He must do his work, Dr. Ramathuba added. She asked her staff to send a bill to the Zimbabwean government for all its national aiding, that she will issue a press stating how many millions of rands Limpopo is owed by Zimbabwe. She says Zimbabweans are now so brazen that they write on their Zimbabwean maternity cards that they will give birth in South Africa. She sympathetically said they are doing that because the health delivery system in Zimbabwe has collapsed. There is nothing there, she said. Zimbabwe has been destroyed by ZANU-PF looting of public funds. And is takataura panamba before takati kune mukadzi ane pamuviri, it's cheaper for her to actually buy a bus ticket 450-480 rands kuti aende ku South Africa aenda anodeliver mwana ikoko than kuti aende kuparanyatwa. Many women have been doing this, and that time now vanhu vakurealize kuti okay, saka vanava ndo zvavari kutoita, vanava ndo zvavari kutoita, saka zvatora nguva kuti vazvirealize kuti is a system that more Zimbabweans are using, kana kuti vaizviona zvavo but vairamba vakanyarara until MEC vazobuda pachena vazoti aiwa, this is enough is enough. And so tapinda mastreets, of course people had to say a lot regarding to this. Someone said kuti she is too much, this one, she is sending the message loud and clear. The Ramaphosa administration is sharing on behind closed doors. Is the message is getting clear and clear. Meanwhile, in Zamunda, one person is a vice president, Oita 40 minister of health, in a country with over 6 million adults. Hashtag register to vote for change. That's definitely true. I mean, for you, by now I would have expected the vice president Chiwenga could release a statement regarding to that, because he is the health minister of Zimbabwe. He is the man, but the man is quiet. The man is actually doing other things. He's preoccupied with other things. Of course, he's a vice president at the same time. He's a minister of health, and I still think he's one of the worst health ministers we ever had, like for real. And he is one of the worst, because as a health minister, you are supposed to be addressing this kind of allegations and actually saying, Twitter say, what can I say to the people of Zimbabwe regarding to what is happening in South Africa, regarding to our nationalities in South Africa. I mean, statement rakaishowa kudhara, vangadai vakamira kudhara vachivenga vakatiudza kuti what's the next step forward, chichi kunyatsoitika. Are they distancing themselves from their citizens, kana kuti are they rallying behind their citizens, kana we need a clear understanding from the Ministry of Health. But as for now, apana varizi vakanyarara kuti zi, maybe they are doing it behind closed doors, no one knows. Someone saying kuti you can tell she is the backing of her government. The message is loud and clear. Zimbabweans register to vote. Kuti madam, keep putting pressure and don't even shy away. You are doing a good job. Believe me, those corrupt looters are not even ashamed. But anyway, she must send the bill regardless. They've run the country into the ground. Cyril Ramaphosa is hiding behind the MEC with a direct message to Mnangagwa. Someone said, if Zimbabweans don't redeem themselves by voting wisely in the next elections, then they will have themselves to blame, because eventually their neighbors will shut their borders. It is understood we are brothers and sisters, but there is a limit to that brotherhood and sisterhood, especially for a country like Zimbabwe, which is able to reset its economy, governance, and social agenda by having the right leadership in place. If ZANU-PF has failed its citizens, then it's better for them to make a choice of whether to continue with the status quo or redefine their destiny by making the necessary changes to help them redefine that. Napita Mukwai and Muaruti. It boggles my mind that Mnangagwa calls himself the president of the Republic of Zimbabwe when the citizens have been reduced to being a laughing stock in neighboring countries. Woe to him and his supporters. And so guys, that's the latest here. Katita in the comment section. Remember to like, share, comment, and follow. Yes, MEC Limpopo vazudzora tsvimbo vacharamba vachingojanya ipapo. And yes, these videos will be making viral all over social media. Everybody will be talking a lot about it. It's high time that the government of Zimbabwe needs to address this situation. They really need to address it. They really need to put a statement into it. There's nothing more diplomatic about it. It's very simple. In healthcare in Zimbabwe, yes, many people are now coming to South Africa, Botswana, other countries to seek medical health. Kazhinji kacho vanenge vasina mari kuti vanozodzamara voenda kupublic health care, of which vane mari vanoenda kumaprivate, but vasina mari vaya manje ndovazvo vanenge vari musystem zvikutonzi aiwa muri kuwandisa because you guys muda kurapwa mahara munenge musina mari. And so they're now saying kuti kana usina permit, kana usina asylum, usina anything, vanokurapa zvako, but you have to pay first. You have to pay a deposit. Other than that, they won't help you. So you have to pay in some hospitals. For free, but most hospitals vakutoda mari upfront kana usina any document unenge unayo. And so this is daily news, breaking news, everyday news on print, New Line TV.